Hello, Mr. Smith. My name's Mike. I'll be your nurse today. I'm going to go ahead and just perform a little respiratory assessment on you, if that's all right. All right, fantastic. Are you having any difficulty breathing, any shortness of breath? No, none? How about any difficulty chewing or swallowing? Okay, fantastic. Good. Glad to hear you're not. I'm just going to take a listen to your lungs really quick, all right? Deep breath in. Good again. Deep breath. Again. Great. Do you mind sitting up for me? Oh, Mr. Smith, I notice you have a little bit of a cough there. How long have you had that cough? About a month? And is it constant or just occasional? Just occasional? Okay. Do you have any sputum coming up with that cough? Just a little bit? Is it thick or thin? It's thin. How about any color to it? Is it clear or yellow or green? It's clear. Okay. Do you mind opening up your mouth for me, please? Do you notice a dry mouth or anything? None? Okay. Well, thank you very much, Mr. Smith. I'm going to go document your assessment now. Alright, so I just completed my respiratory assessment on Mr. Smith, and I left the room, and now I'm out at the nurse's station, and I have to now document that assessment I just performed into the electronic health record. So I'll double click and get my electronic health record application open, and while it is loading, once I'm in, I will access Mr. Smith's chart, and I'm going to go to the respiratory assessment portion of the chart. I will have to put in my date and time, which was 11/12/14, and this was at 0800 this morning. And now to the questions within the EHR. For his respiratory symptoms, there were none, and the patient denied any shortness of breath. His respirations were not normal. Chest expansion was symmetrical. His left upper lobe was clear. Left lower lobe was diminished. Right upper lobe was wheezing. Right middle lobe was clear. Right lower lobe, if I remember right, diminished. Did he have a cough? Yes, he did. Frequency, he told me that it was a 1 month duration. Oh, I already messed up there. Let's see, the frequency was occasional is what he told me. Duration for 1 month. Was it productive? Yes, it was productive. Sputum, yes. Amount was small. Consistency was thin. Color was clear. His mucous membranes, pink. Description, I'd say they were moist. And the patient denied any difficulty with swallowing or chewing. And that is my documentation of the respiratory assessment post-assessment. Hello, Mr. Smith. My name is Mike. I'll be your nurse today. I'm just going to do a quick respiratory assessment on you, if that's all right. Okay, fantastic. I'm just going to go ahead and scan your wristband here with my smart device. Okay, fantastic. What that does is, as I do your assessment, I'm going to be speaking into my smart device, and it's going to transfer my voice into your electronic health record. Is that okay with you? All right, fantastic. So let's go ahead and get started. Mr. Smith, are you having any difficulty breathing or swallowing? None? Okay. Patient denies shortness of breath, any difficulty breathing or swallowing. Alright, I'm just going to go ahead and listen to your lungs. Will you please take a deep breath for me? Good. Again? Great. Again? One more time. Fantastic. Let's go ahead and have you sit up for me, please. Respirations are not normal, they are symmetrical. Lung sounds: left upper lobe clear, left lower lobe diminished, right upper lobe wheezing, right middle lobe clear, right lower lobe diminished. Oh, Mr. Smith, I notice you have a pretty good cough there. How long have you had that cough? For about a month? Is it occasional or just, is it constant? Occasional? Alright, and does anything come up with that cough? Any sputum or anything? A little bit? Is it thin or thick? It's thin. And is it clear or yellow or green? It's clear. Alright, fantastic. Hang on 1 second, please. Cough present. Patient states occasional. Duration 1 month. Productive, yes. Sputum amount small. Consistency thin. Color clear. And go ahead, just open up your mouth for me, Mr. Smith. Have you had any dry mouth? None? Okay, thank you very much, Mr. Smith. Mucous membranes are pink, moist, and patient denies any other complications. Alright, Mr. Smith, thank you very much. I'll be back in 1 hour. Alright, so I finished my assessment in the room. I used my voice-controlled device and spoke my assessment into it. While I'm either in the room or now out at the nurse's station, I need to go into the electronic health record and validate my documentation that transferred over through the interface. So I'll double-click on my EHR icon. It will open up my electronic health record application, and it'll take me to my patient's chart. I go to the respiratory assessment section, and my documentation that I did during the assessment that I spoke into the device is already in the chart. So my date and time that I did perform the assessment is in there. My respiratory symptoms are in there. All the documentation I spoke into it. So I'll quickly look over it just to ensure that it's accurate. And I agree with everything. And then it asks me at the end, would you like to acknowledge this documentation? And I click yes, and I would file that. And now my electronic documentation that I voiced during the assessment is now saved in the EHR, and I'm done with my assessment. Much faster than sitting here documenting the whole assessment afterwards.